Thank you very much, Maurice. It's a strange feeling for me taking the floor after Heike, because as a chairman I was used to have similar speeches explaining and giving testimony on what I lived with my family, with my father, with the sisters and brothers of my father. So it's a strange feeling that I'm now supposed to speak about economics in this field. Yes, indeed, I'm the co-founder of the Luxembourg Association in '87, and the other one is sitting over there, Paul Diederich. He was the one who founded the association with me, and yeah, I was at that time we called it chairman, but we changed, and it's now chairperson. This was due to Jean-Georges. He started his job as a Secretary General with me. He was working with me before, and he learned me that it is not chairman, but a chairperson. So he gave me the first feelings about this. And looking back to that time, we were, at the beginning, I was saying, not very professional. We had initiatives by people that were visionary people. Michael Kut and Henk de Haar were the ones that were chairpersons before I came to office. And fortunately enough, by that time, it was the first time that the Commission, the European Commission, was able to support some projects. They were concrete projects, but nevertheless, it gave us the possibility of having structures that enabled us to get a little bit more professional than having simply someone somewhere sitting and taking sometimes the telephone. So we went professional from that time, and it's due to the Commission that we were able to do this. We opened the office in Luxembourg, and this office is still working in Luxembourg. I'm glad to have been able to serve Alzheimer Europe for 6 years. I was also attending all these meetings of ADI. At that time, we were sometimes quarreling, as it is usual in the NGOs. But nevertheless, Jack Selmes took over, Maurice, and now Heike, that I know pretty well. Heike, good luck. I know it's not easy. And by the way, I'm not completely out of the game. Of course, I cannot be involved anymore in the services because we are providing some subsidies, so you cannot, you have a conflict of interest, but I'm still the chairman of our foundation. The foundation is not providing services, this is the association, but the foundation is trying to get money. So I do what now I do best, is taking care of the money. But let's come back to the times we are living currently. Tough times. Tough times in all the countries in Europe, worldwide, but above all, let's come back, as we are in Europe, to what is going on for the moment. Governments are struggling, their deficits are taking huge amounts of money now, and they need to have a deep depth initiative, every one of them. And there is, in every country now, demonstrations, problems coming up. And the question is, when you have had such a difficult time with the financial crisis we had, and we had to get into the banks, get to save them, save companies, put money really out of our box and out of the box of the taxpayer to these companies. Obviously now we don't know how to get the money back. And the problem is that we are struggling on this. But we have to get out of this debt crisis. The countries all suffer for the moment, and no government more or less will be re-elected if it goes for election for the moment. I think in all the countries the governments will be thrown out. So we try and have not elections for the moment. Would have been difficult. And what happens? Where can you save money? Look at what Ireland has done a couple of days ago. I know it is. A lot of critics came up when Ireland, when Greece, when Portuguese people and Portuguese government have decided their money-saving programs. But obviously you have to cut. And you cannot cut everywhere. And there is a tendency of cutting in investment, which is crunching down the slow evolution in the economics for the moment, so it's difficult. You can cut down in social transfers. That's what people for the moment try also. And all this is coming at a time when we need more money for aging population. More money because aging population will be one of the most important issues, not for social ministers, not for health ministers, but for financial ministers. So we will face difficult times because we know, and we are speaking of costs here, and I will come back to this. We are speaking about costs because aging population, which is something interesting, people getting older, but also diseases coming up are different. And the time you spend in disease and in care are different. Pension reforms are being made. So you have a time where governments have to cut down their expenses and, by the way, need more money for one of the biggest problems that we are all facing in Europe, which is aging population. And this growing concern would normally also bring money to this sector. And hopefully, because when you measure competitiveness, which is a word out of the economical world, but competitiveness is much more than only competitiveness of costs. Competitiveness is also quality of life. That's how I sell Luxembourg, saying here high quality of life for the investment. Here you have a very good environment as such for your children, for your spouses, for the people who want to have cultural activities, and not to forget for the health system. We have a very good health system here in Luxembourg, and I sell it as one of the major competitive advantages, saying your people will be taken care in a good way here. So you see, from a pure cost factor of the aging population, we try to make in the competitive discussion also an issue of saying this can be an issue that is interesting for the country and not only a cost factor. Luxembourg has a health insurance which is very good, of high quality, at least for those who can testimony this and living here. High quality, 6.5%, and you're in it for the employer and the employee. But of course, the government is supplying more or less to the health insurance, for instance, 40% of the expenses. But we have high quality and easy access, no different health insurance levels. Everybody has the same level. If you want to have something more, you have to go outside to another country. We added to this, and we copied, in fact, the care insurance of Germany. Not entirely, but to a certain extent. So now everybody pays. And also health insurance is mandatory for those working here. So there is private health insurance, but you have to pay anyway for the public health insurance. And for the care insurance, it's also mandatory. We take 1.4% out of every revenue you have, and we bring it into our care insurance. And it is at a high level too. High quality, expensive, yes, but it is working. It is working, and it's another advantage for this population here in Luxembourg. Because for elderly people, what else than the services that they can have when they are getting old can we provide them? It's not making them travel at 85 years that will make them a pleasure, but a good service for care levels, every care level is the most important factor. And I can give you a figure, which is the contribution to GDP of everything now related to health and social services. By the way, we have a minister in charge of health and social security, and we have a minister in charge of social services, and also for us, Heike, even as a member of the government, we sometimes laugh and say, we could innovate by coordinating a little bit better what we are doing. This would be an innovative gesture of importance. So I know this problem. But it is not only health and social services. And I will come back to this. As a minister of the economy, I was far away from all this. Now I'm coming back into town. I'm coming back into life sciences development. I will talk about this later. So when you take the Luxembourg GDP, which is normally quoted as one of the biggest and highest in the world when it comes to per capita, but the calculation is wrong because they forget about commuters. We have 43% of our working population here are commuters coming from Belgium, France, and Germany every day over the border. So they are not in these figures, and this gives a slightly different picture if you take them in. Then the per capita GDP of Luxembourg is still very high, but it is not the way it is very often quoted in official papers. And this GDP contribution now of health and social services in a country where financial services take already 30% of the GDP is now approaching 5%. 5% of contribution, and if I come back to the job creation, you will see it's even different. And when you compare it now with employment, what is the level of employment? We are approaching 8%. It's 7.6% of the job creation here in Luxembourg, of the employment level. And when you compare it to our industry, industry is more or less 9%. So it's only a small difference, and we have quite an interesting industrial sector. It's not that there is no industry here. The financial sector is covering 11 to 12%. Remember, the social and health services, more or less 7.6%. You see the importance. And now we can speak that it is not only a cost factor somewhere in the state budget, but it's becoming an economical sector, which is a kind of investment now for governments, and not only a cost. Yeah, of course, we need still also these merchant, because this is non-merchant jobs, merchant jobs, because the financing of these are mostly coming out of public funds, or let's say private insurances. And the job creation here in Luxembourg at a time where we are one of the only countries still creating jobs. We were at between 3 and 5% during the last 10 years of job creation every year. We are now back up to 1.5, 1.8, more or less. Most of the countries are not even below 0 now. And in this, the social sector is providing 0.4. Out of the 1.5, 0.4 is the social services providing. So you see, if we would not have the social services job creation, we would have a huge loss in our job creation figures. And there you see that in a small country, you can have suddenly a sector which is a sector known for being costly, and it's at high cost. The Luxembourg system is a high cost system, but it's now becoming more and more an important economic factor. Yes, still in these jobs you will find more women. 75% are women in our jobs environment. And it's obvious. You have far easy part-time job possibilities which women can easily ask for, whereas in the private sector, in the financial sector, in the industry, it's much more difficult. There is also a certain flexibility when it comes to time management, and all the day care services at home give you an opportunity of working differently and taking care maybe of the children. Whereas normally it's all the two partners that should take care, but everybody knows that more women are doing this. So you see, it's a sector where more women are for the moment being represented, but however, I think there will be a balance in the next future. Aging population, last figure, the expenses linked to aging population in Luxembourg, when you take the pension, the health, and the long-term care, you end up with 20% of the GDP level. So expenses, when you bring it to the level of GDP, it's 20%. It's not the contribution to the GDP, but it's the level that you see. So it's an important factor nowadays, and nobody can do without. And there are huge differences now in the countries. When it comes to comparing what is the different countries doing, take Eurostat and have a look at it. It's interesting because you will see that, for instance, Sweden and Luxembourg, more or less at the same level, are contributing euros per habitant, more or less the same, 1,000 and 300 euros, they are contributing per habitant to long-term care when it comes to all the population. Whereas Switzerland, Iceland, Denmark, who are the next best, are at 800. And when you go down to young, I say young because they are new members of the European Union, but also countries like Australia, US, you end up with very often less than 10 euros per inhabitant. See the difference. Sometimes 10 euros and less, and then 1,300. So it is a huge difference. But of course, all these countries are catching up. They are new in the business. They had different systems. Some had more public investment, others more private. And healthcare, as I said, is an economical factor now. When I look at the people who want to invest in Luxembourg, they want to know, my expats, what will they have as a quality of life? What is their productivity factor? Are they very often ill? How are they being taken care? These are factors that can be calculated. Of course, the healthcare sector, when it is looked at by managers as a cost factor, when they invest in a country, they also look to, because it's a kind of a tax that you take, it's also a source of fiscal pressure. Last idea, the public health expenditure, when it comes as broad picture, as a percentage of GDP, it's quite different in many countries, but you see that all the countries have a certain convergence, catching up process is evident, largest increases are in the lowest initial levels. Last word about long-term care delivered. Yeah, we will see more people having the age of 80 and more. By the year 2060, I think the Commission thinks that it will be multiplied by 3. And as I said, availability of informal carers and their propensity to provide care, I'm not sure that it will be enough. I'm even pretty sure that it will not be enough, and that we will need more formal care than informal care. And formal care means, of course, a higher cost level. But for the welfare of elderly citizens, I think availability and access to it, to formal care service will be key. Yes, I said I was far away from social services and health as the Minister of the Economy. And I'm back to it now. Back because Luxembourg discovered and developed now life sciences. Not biotech as a large sector, but life sciences. And in life sciences, it is the diagnostic element which will be the main driver. And when I saw the outlook of the Commission, when I saw the outlook and the wishes of Heike, believe me, we have one factor that we don't need to push it. We have to follow it. You know, the Lisbon strategy in 2000 stops now in 2010. Was everything having better knowledge-based society? Maybe we didn't reach the target, but we worked a lot on it. And what was extended was research and development. And if there is one sector, one department, where there is no discussion now in all the countries of providing money, it is to research and development. But it's nice also to have people who find something and not only look for something. And it is nice to have research and development now. Yeah, it must be effective. It is not, it's sometimes nice to have the sexual life of any mosquito in South Africa, the effects of it, but it must be more interesting of knowing how is the issue of Alzheimer for the moment being costly for us, and how can we, by the new diagnostic methods, by new treatments, how can we cut down all these costs? So I hope at least, and we will do in Luxembourg our part of this, invest in companies, in joint ventures, where the dementia issue will definitely be one of the points. And at least as long as I'm a Minister of the Economy in charge of this, I will take care of this. I know where I come from. But in all the countries will have to face 3%, because that's a target now, one of the 5 targets for the 10 years to come. So push them, and push them so that they will take care of the issue of dementia and, of course, of Alzheimer. And we are working on systems biology, biobank, biomarkers, and personalized medicine, meaning on genetics, finding out better drugs, the drugs that are more effective, so that you don't have, be it for cancer, be it for other illnesses, to have many drugs until you find the one that is suitable for you. And it comes back to proteomics and to the analysis of the genome. We will work on this here in Luxembourg with the help of institutes of the United States, working together with Qatar Foundation for the moment. It's an interesting movement in all the countries. It's not only here in Luxembourg, but I know the Luxembourg situation best. And we had a board meeting of a joint venture of an interesting company where we are a shareholder. People from the United States came for this board meeting. They were attending, and we have asked them to attend the opening ceremony here of your Congress. And I met them afterwards to discuss the issues of our company, and they were talking about it and taking the issue of Alzheimer really into their business, not only for me, for making me pleasant to them, but they obviously were impressed by what they have heard. So, as I said, I'm back in town with Alzheimer Europe again, and I think we need formal care. We need research and development. We will have it. We need SMEs and even big companies to work on it, on drugs, on treatments. But we also need the people who are involved as a family member with those who have a problem. And let's not forget about them. They are at the beginning, but they are still there, and they are still suffering the same as all the families were suffering when I first met this disease. I didn't even know the name at that time. It was in the beginning 80s. So we've done things, and we can do things differently than others, than professionals, than formal carers. We need the two of them. But sometimes we need to tell them that we can do it in another way. And we need, and that's for the Commission, it's also for the government, so I'm looking at myself, we need the support for those who support. Thank you.